How can I help my baby sleep better? Infants have developmental stages that they go through as their sleep progresses. When they're first born, they seem to sleep constantly, and that's really normal. During the first few weeks, they'll spend most of their time asleep. As they get older, as they close in on 1 to 2 months old, they'll start to develop night and day preferences just like we do, where they'll be sleeping more at night and awake more in the day. But you might not see that until about 2 months old, and that's okay. Your baby will get there. You'll just have to be patient with them. Keep the daytime bright and active, keep the night quiet and dark, and they'll usually get the message on their own. As they get older, it's important to help them learn to self-soothe to fall asleep. This is usually best started between 4 and 6 months old. And the reason is that as the baby's brain develops, they start to develop what's called object permanence. And this is when the baby can start to remember that something that they don't see is still there. And when that something they don't see is mom or dad, and they know you're there, and they haven't yet learned how to fall asleep on their own, they're gonna ask you to come in the room or ask you to hold them or feed them so they fall asleep every time. And so the best time to start helping them learn to fall asleep on their own is before that really gets good, because that baby's gonna get smarter every day. So you gotta start a little bit early so they'll learn good habits before they start to develop that object permanence and separation concerns. So usually between 4 and 6 months old is a good time for that. You can start that by continuing your same nighttime routine as far as bath or feeding, holding, rocking. The key is that you want to lie your baby down in their crib shortly before they fall asleep, when they're still sleepy but not totally asleep. And then you can pat them or touch them, talk to them, and gradually withdraw that over time as they learn to soothe themselves. A lot of people ask, what's the 4-month sleep regression? I hear about that when a baby just stops wanting to sleep. A lot of times it's not the sleep that's worse, it's the baby that's getting smarter. Their senses are better, their vision is nearly normal at that point, and they've developed strong bonds with their parents. They want them around. And so, that's really the cue that it's really time to start that sleep, help them to learn to fall asleep and self-soothe at that point. And that's, again, usually between 4 to 6 months old. After 6 months old, most babies can sleep through the night without having to wake up to feed. Nutritionally, they don't need to do it. Some nursing babies will still want a feed or two at night because that seems to pass through them a little faster than the formula does. And that's okay, but primarily working on that first falling asleep at night, and usually the rest will take care of itself over time. Most babies are still taking several naps, at least 2 a day at that point as well. As long as the infant naps seem restful and soothing, they may range from an hour or 2, and that's fine. Typically, most children at that age are still getting 12 to 14 hours of sleep in a 24-hour period, and that's kind of your goal. How that breaks down and splits up can be a little flexible.